Support for Radio Friends comes from Columbia Healthy Smiles, the dental office of husband and wife team Dr. Batson and Dr. Abe, offering comprehensive and customized care to patients of all ages. Learn more by calling 573-721-9039 or online at www.columbiahealthysmiles.com. Good morning and welcome to Radio Friends on Wednesday, August 23rd. Pleasure to have you with us today. We're going to talk about something that I really know nothing about, and that is hormone therapy. And I want to introduce you to Dr. Bob Bynum. Good to have you here.
Well, thank you very much.
Before we came on, I asked you, I said, is this new? You said, hormone therapy has been around for a long time. How come we don't know more about it?
Well, I'm not really sure why that is. I mean, it's out there. It's been available. What we do is bioidentical hormone therapy, which is different because this is not synthetic hormone. This is your own natural hormone.
Okay, let's start off by explaining what is hormone therapy.
So it's augmenting or manipulating the natural hormones in your body. And that's usually it's classified as estrogen, progesterone, and testosterone for women.
Okay. So what do you do?
Well, what we do is we take a collection of blood, checking hormones and other modalities, and the idea is to optimize your health. And so specifically women, we would look at their FSH, their estradiol levels, and their testosterone levels. And the idea is to take what are their symptoms, so it's, how do you feel? And then by augmenting their hormone levels, you can help address those types of symptoms. So like, for example, testosterone is known to help with stress, depression, anxiety, and exhaustion. So when women mature, they get lower levels and they have these symptoms. So the idea is to combat those symptoms by using hormone therapy. We also use thyroid and other modalities, but hormone therapy is what we're going to discuss today. Now,
you mentioned women. Do men do hormone therapy also?
Yes, they do. I'm a little biased because men are slow. They tend to not respond quite as fast as women with hormone therapy. But yes, they specifically would be testosterone-only type therapy. And yes, it can help men as well.
Why do you say men are slow?
Well, when you're taking a hormone level and you're maybe doubling it for a man, a woman, you may make a 5 to 10-fold increase in hormone levels.
Okay, but with a man?
It's not that great of a increase as far as doubling compared to a 10-fold for a woman.
Will a man notice a difference?
Yes. It's a kind of tongue-in-cheek thing I say about men are slow because we do respond, absolutely. And so hormone therapy is, as you can tell, it's kind of complex, but the value in hormone therapy is the emotional value, stress, depression, anxiety, exhaustion. The physical value is that it lowers your risk of dementia, heart disease, breast cancer, and osteoporosis.
Now, you're talking about for women.
Well, men as well, but those aren't typically man-associated issues.
So how do you do the hormone therapy? Are you taking our own natural hormones from the body and then enhancing them?
No. What we're doing is we actually do what's called pellet therapy. So we take hormone the base is from yam, okay, and it's manipulated to be the exact molecule, not a synthetic or pharmaceutical molecule, the exact molecule of testosterone in your body. Okay? And so we give that to you in pellet. We slide that underneath your skin, and it's released based upon your cardiac output.
In pellets?
Pellets.
You mean it's like a pill that you're putting under the skin?
It's like a pill you're putting under your skin.
And then it dissolves?
Over time. For a man, it lasts typically 5 to 6 months.
But he's not going to notice the difference like a woman would almost.
Well, it's not 100%, Paul. I mean, nothing is 100%. But women tend to be 90% or greater success. Mm-hmm. I would say men are probably that way, but sometimes you have to build the levels up, and for a man it can be a little slower for that. Mm-hmm. I'm probably overplaying the men are slow part, but women sometimes will have a response in 3 days.
Really? Mm-hmm. Is there any danger or side effect to this?
There are potential side effects. Okay. I don't know the word danger is a good word to use. I mean, there's things like complications, like you could get an infection because you make an incision, but those are things that we've really not ran across. But the potential is always there. So the most common side effects for women would be hair growth and acne, okay? Those aren't that common, but they can occur. And the reason they occur is the levels are too high for their body. We're all individuals, and so sometimes you can give a woman a dose and the next woman the same dose, but yet this one will react and this one won't. Mm-hmm. And so you just have to modify the dose.
If they would start having hair growth, if you cut it back, is the hair growth going to disappear then?
It will minimize that. I will be honest with you, many women will notice like a little peach fuzz, but they feel so good they don't care. Okay. They'll just dermaplane or shave or pluck.
So that would be, there are no major side effects to that.
I would say that's a fair assessment.
Okay. If people want more information on this, where do they start?
So what we do is an assessment because your symptoms are important, okay? Many times in medicine, we focus on a piece of paper, okay? The piece of paper, the lab result, is to validate the symptoms, okay? So we start with a symptom and a blood test, all right? And so if you have symptoms of low estrogen, then we want to address that based upon your labs.
Okay. Obviously, it's a little bit more complicated than we have time to talk about it. But if you want more information, we've got a phone number for you to call. That's 573-443-0075. Bob, thank you so much for coming by.
I appreciate the opportunity to try.
It was an interesting conversation. Obviously, this is not for everybody, but if you're interested, you can give them a call on that.
Absolutely.
Thank you.
It's been life-changing for a lot of women.
All right. Thank you, Bob.
You're welcome.
Something you'd like to hear or see, I'd love to hear from you. Just drop me an email. That's pepperp@missouri.edu.